Response Alliance, a WHO-hosted network. Then we have Rike Bingerling, who is the project coordinator for Ground Truth Solutions. And finally, we have Mateus Bizarria, who's the community engagement and accountability delegate for IFRC Africa. So before jumping into the report presentation and the conversations, just a couple of issues on the housekeeping, the event housekeeping. You're gonna be all muted. However, we really encourage you and invite you to share your questions and your comments in the chat. We just decided to have you all muted because we're a lot of people, but we will make sure we go over all the questions and try to bring some of them to the speakers as they share their insights. And when possible, we will also we will try to respond in the chat. In terms of translation, we will have like French subtitles. They are set up for everyone. So if you're joining from a French-speaking country, you'll be able to follow. And finally, if you have any concerns in terms of technicalities or you have any colleague who cannot access or things like that, please get in touch with my colleague Christoph Hitayesu. We will be sharing his email in the chat, so he can support you as soon as possible. So now I'm jumping, letting my colleague Alejandro start with the presentation of the first set of findings. Over to you.
Hi, everyone. Thank you, Rocio. So as Rocio mentioned, my name is Alejandro Posada. I'm the lead social scientist for the Rooted in Trust project. To tell you very quickly about Rooted in Trust, it is an Internews project financed by VHA. We're a global pandemic information response program that's countering the unprecedented scale and speed of the spread of rumors and misinformation. Our objective is to ensure that communities have access to accurate, timely, and actionable information about COVID-19 and also other health topics delivered in the language and formats that they prefer, so that we can support well-informed decision-making. So if you want to find out more about our project, you can visit our website. Today's presentation is a report in one of the various research activities that is and has been carried out during Rooted in Trust. What we saw here is that during the COVID-19 pandemic, we have seen an unprecedented increase in the use of social listening methodologies for humanitarian response and infodemic management. This increased attention has resulted in a variety of social listening outputs that are produced by various institutions and shared at the national, regional, and global level. However, despite this proliferation, we identified a gap in the evidence, particularly when it comes to how social listening data is being turned into action, what are the impacts of using social listening data, and what are the main barriers that are preventing organizations from acting upon social listening findings. To start filling this void, we performed key informant interviews with 7 organizations that are or have been at the forefront of social listening activities as part of the humanitarian and health response. Some of those key informants are going to be joining today's conversation. So to tell you very quickly about the structure of the paper, we basically asked interviewees about the difference between their expected results from social listening and what they've perceived that has happened so far. What we realized is that there's an important difference still between the expected and perceived results. Mostly, while social listening is effectively being used for messaging and communication efforts, many of the more structural promises regarding the use of social listening to inform decision-making, policy, and program design are still to be fully realized. So we continue to identify the barriers that might be causing this gap between expected and perceived results, as well as brainstorming some recommendations together with interviewees that could help mitigate those barriers. What we identify is that the barriers that determine the use or the action that's taken upon social listening data actually exist throughout the various stages of the social listening workflow. all the way from collecting the data and analyzing it to when it's shared and disseminated, and finally when it's actually turned into action. So for the rest of today's presentation, we're going to go into the barriers and recommendations that we identified in each of those 3 stages of most social listening projects. So to start us off with the first set of barriers, we're going to talk about barriers associated to the collection and the analysis of social listening data, but particularly those barriers that end up affecting the usability of the data or ability to act upon that data. It is important to mention here that we noticed throughout our interviews that there's a lot of diversity in terms of the tools that are used to collect the social listening data. The type of data that's collected also varies a lot, and the type of analysis that's used. For this research, we focus on general barriers. However, it's important to keep in mind that they don't all necessarily apply to all projects, given that diversity of methodologies. So to jump into some of the barriers, the first barrier that we identified has to do with the nature of social listening data. As we all know, social listening data is real time, it's abundant, and it's qualitative, which is part of what makes it so attractive. However, this also complicates collection and prioritization, particularly for manual or those that are doing not relying on softwares. Additionally, what gets collected is also highly dependent on collectors' capacity and bias. Again, also particularly for those that are doing in-person social listening. Finally, in this barrier, we saw that there's a quantitative and qualitative dilemma when it comes to how we analyze social listening data. Qualitative can be very time-consuming, and there's a belief that quantitative is more valuable and usable. However, the richness and the depth of qualitative analysis, which actually looks at the why behind the data, can actually be key for an analysis that influences decision-making. Our second barrier here has to do with listening in social media specifically. The main issue that we identified here has to do with representation. We have to ask ourselves whose voices are being left out. As we know, there's still a lot of digitally disconnected populations around the world, but particularly in humanitarian settings, all the way from lower income, women, and elderly, depending on the context. We also need to think about whether what we share online actually reflects our concerns and beliefs, and it might not all the time. A second part of this barrier is related to the use of social listening software, which many projects rely on. A lot of this software were actually intended for marketing purpose originally, and so they miss some of the nuances necessary for humanitarian context or emergency settings. For example, it misses private dark social media channels such as WhatsApp and Facebook chats, which for vulnerable populations that face constant harassment are actually key and safe spaces to voice their concerns and needs. So we might be missing some of these conversations when we rely only on the software. Similarly, minority languages are also many times missed by the software. The interviewees mentioned that the lack of representativeness can influence buying and the perceived value in our data. However, the failure to acknowledge the lack of representativeness can actually further alienate and marginalize those voices that we are listening to. So there's a bit of a dilemma within that barrier. The third barrier has to do with the way in which we analyze social listening data. Traditional analysis and software tends to privilege engagement statistics for analysis. So things such as shares, likes, retweets, data points that have a lot of that will get more visualization. However, in humanitarian settings, engagement is not necessarily correlated with the risks that are faced by affected population. This type of risk analysis actually requires a human eye that can look at the cultural, the socioeconomic, and the power relations that are embedded in the data. However, this is not necessarily easy to acquire, as we will see in the next set of barriers. A barrier that we identify through our interviews has to do with human and financial resources. Basically, the teams told us that analyzing social listening data requires a particular skill set that sits at the intersection between public health, communication, data analysis, and humanitarian work. You basically need someone that can translate data into recommendations for all phases and all sectors of the response beyond just communication. However, teams emphasize that this is not necessarily easy to find, and that this type of training is actually time consuming. It takes time. The final barrier that we identify in terms of data collection and analysis has to do with collaborative data collection. Basically, all interviewees agreed that collaborative data collection and analysis between organizations and institutions would actually be ideal. However, there is a lack of common standards when it comes to social listening, which actually complicates centralization. It is important here to emphasize that standardization could also bring some problems, as we would lose some of the flexibility that is required for a localized and contextualized response. So we've presented 5 of the barriers or dilemmas that we identified in terms of data collection and analysis. And now, before we jump into the other speakers, I'm going to go into some of the recommendations that we identify that could mitigate these particular barriers. These recommendations are not meant to be all-inclusive, but they're just a set of brainstormings that we had together with the key informant interviews. So for donors, the first one would be to invest in local infodemic management capacity. For example, in things such as infodemic management trainings or allocating resources to develop social listening tools, and particularly important to develop data analysis skills at the local level, where the needs are actually the highest. For decision makers in the humanitarian and the health space, we have also a set of recommendations that could be used. The first one is that before jumping into the actual data collection, it is very important to define your social listening scope. Are you going to be listening at the local level, at the national level, or at the regional level? This will define the usefulness and the type of analysis that is desired for your data. For example, we saw that for many actors on the ground who aim to directly, we saw that local data may actually be useful for actors in the ground who aim to directly tackle specific issues within communities, while it might actually not be that relevant for national organizations that are looking to analyze population level response. What is key is that you want to do what you want to do with your data and the scope. It's going to be tailored to the purpose that you have. The second one is to acknowledge the limitations of the data and present the value that it has beyond it being representative. Interviewees mentioned that the lack of representativeness can actually be detrimental to the value that others place on our data. As such, it is important to complement with other forms of research that can also fill those gaps. The final recommendation for decision makers is to work with local partners who can actually not just collect, but analyze the data. Working with community-based organizations can reduce the biases of outsiders in the data collection, and their contextual understanding can allow you to identify priorities that others might miss. Communities can bring their understanding of linguistics, social, and cultural frameworks, as well as the values and the risks that are embedded within the data that we're collecting. Finally, 3 sets of recommendations for data collectors. The first one is to co-create with communities a map where you identify the online and the physical spaces where the community gathers, as well as the influencers that they talk to. This is especially important to consider when your project has a specific target population, as they might actually have very different habits of how they exchange information. The second one is to identify information gaps before you actually start collecting. This is in response to that abundance of data, and to pair social media listening, so online listening, with in-person listening when possible, in-person being offline listening. Finally, it is also very useful to triangulate data. Social listening is a rich source of data that can provide us with very concrete insights, but as we've discussed, it has its limitations. So consider triangulation with other tools such as assessments or KAP studies. Those are the set of the recommendations. And now back to Rocio.
Thanks so much, Alejandro. Thanks so much for sharing this first set of findings. Now I would like to hear from Rike from Ground Truth Solutions and hear what she has been experiencing also throughout her work and also what her colleagues have been facing in terms of barriers and what mitigation strategies also did they put in place to address some of these barriers in the data collection and data analysis phase. Over to you. We cannot hear you, Rike.
Can you hear me now? No? Yeah, okay. Sorry, it's always with Zoom. So thank you so much for having me here, and I will try to keep it short. At Ground Truth Solutions, we had multiple projects during the pandemic on people's perceptions on COVID-19. And usually in our projects, we try to collect data face-to-face and working with the data collection partner. But during the pandemic, we had to pivot, we had to change our way of working. So what we did is we often switched to phone surveys, or we worked through local volunteers or local aid workers, frontline aid workers, to collect data mainly on rumors concerning COVID-19, but also perceptions people had on the pandemic and on the response. And we were active in Uganda, Iraq, Central African Republic, Syria, Somalia, and Bangladesh, just to give you a little bit of context. So some of the barriers we faced were mainly obvious barriers, such as access to communities. Of course, if you collect data over the phone, you're gonna miss out on a certain group of society who are often less digitalized, who do not have access to phones, such as older populations, often women or people with disabilities. But also we collected data through frontline aid workers and community volunteers. And because they had to collect data from their own communities on some of these rumors, there were a couple of dangers that were attached to that. So on the one hand, some of the people who were collecting the data were part of the community and believed maybe the rumors themselves. And yeah, we were not sure how this information then came across and came over to us. But also their relationship with their communities that they were part of changed, because they were certainly from the side of the humanitarians, and sometimes their fellow community members had distrust towards them because they felt that some of the COVID measures were imposed in election times to keep people inside, to pose extra rules on people. So it could also influence the relationship between community members and community volunteers who were collecting these data. And another barrier that we found was that a lot of times we wanted to speak about COVID-19 because it was the start of the pandemic and there were many information needs about this. But in many communities where we were active, this strong focus on COVID-19 was not always in line with their priorities, what they found important. So they actually wanted not to talk about health impact because they wanted to, they did not see it in their community. It was not very present, but they want to talk about the economic and social impact. So we try to do the social listening, but we're not really getting the information that we were looking for. And we understood that maybe we had to shift our priorities a little bit. So some recommendations, some learnings that we took from this was, first of all, in the access barriers, to be very creative in the ways you engage with people. Think about who you can talk to, but also if the people you send out to talk to others, if it might put them in danger, if there are risks for them collecting social listening data, are they best placed to collect these types of data? Are you setting them up for success? Do they need to have more information? So if there's misinformation, they can already address that. Are you putting additional strain on them? Are you kind of jeopardizing the trust people might have had in humanitarian aid workers? Is the trust going to be less after this activity? And I think it's also important to follow community priorities on what they want to speak about. And although there was a strong focus from the humanitarian sector to learn more about COVID-19 and the health impact, how this impacted people's lives more broadly, for example, them having less access to aid, but also the economic impacts of having less options to work were very important for people to talk about. So to still keep following what people's priorities and communities' priorities are. Back to you, Rocio.
Thanks, Rike. This is super useful, and certainly it's an issue that we've been like also hearing from all the different key informants, how a lot of times like there's like this mismatch between what actors want to collect and organizations, the data that they want to collect because they have like already like some programming in mind, and actually like what communities need to speak about, right? And then while there's a need to collect certain data, we always need to be open to what communities need to share and what their priorities are. So in response to that, I would like to connect to Elodie, and because she also has something to say about that and the barriers that they also faced in collecting data that was operationally relevant, but also contextually relevant for the response at the country level. Over to you, Elodie.
Thank you very much, Rocio. So I'm the coordinator of IRA, which is the African Infodemic Response Alliance, and we are a network of more than 14 organizations with very different profiles, with their very different skill sets and expertise. And our goal is actually to tackle infodemics in Africa, and we are also hosted by the WHO regional office. So having said that, when we started about 2.5 years ago, and when we tried to position ourselves, basically we were looking, what exists in terms of community feedback. So what was the practice to listen to the communities? And we saw a gap here, especially when it comes to social media monitoring. And now, the world has changed, including in many, many countries here in the region. And basically, we decided also to invest a little bit more here in social media monitoring to complement what was collected at the community level. And what we found is that, so COVID-19, especially at the beginning, things were changing a lot. And it was very, very hard for us to keep pace of the information, how it evolves, because what we're looking at is basically the questions and concerns that people are sharing. So this is kind of the first thing that we're looking for, because then we will probably want to bring responses to those questions. The second thing is to look at misinformation, potentially. So misinformation can be part true, part wrong, it's kind of inaccurate and not verified. So here it was basically 80% of the information that we were monitoring. And it's a lot, and we're covering the whole region. So it was very, it's very intense from a regional perspective, basically to monitor conversations for a continent like Africa on social media platforms, and also to do it on a very regular basis, because the demand for social media insights was very high, and also for to get insights on a very regular basis. So for some countries, they were asking for insights on a daily basis. For some others, they were asking for insights on a weekly basis. So it really depends on the context. So for us, it was a little bit challenging to keep the pace with that demand and intensity. But what we found basically, because we started with 5 pilot countries, we wanted to test our model, and we really wanted to make it operational and adapt it to the context. So what we found is that it's very important basically to base our intervention on the local resources and what exists already. And if there is no capacity or low capacity in social media monitoring, we can invest in that, and we can provide the tools, and we can train people. But as the report said also, like, the human eye is irreplaceable. You have now a lot of AI tools now that are more and more elaborate, but the human eye is key to provide context and also to give more information about the conversations that are going on, because we at IRA, we take a more qualitative analysis. So we really need a context. When we spot, for example, last week that there will be a festival in Zambia, and there are some cholera cases there. We didn't have the information about the festival, and we asked our colleagues there, the RCCE colleagues, to tell us a little bit more about the festival. And we realized that it's a really big festival, the equivalent of Thanksgiving for Americans. So there is a huge potential here of a high transmission. So this is how we triangulate things, and how also we try to provide recommendations and context to our data. Also, maybe one key thing that we've learned over the past 2.5 years is that time is key. Time is key in collecting the information and also providing recommendations and taking action. The speed of information online is 10 times faster than what can circulate in certain communities. So here, when we spot a misinformation, disinformation, or something that can be a threat to public health intervention, sorry, we really need to act very quickly. So we use that report or that insight to basically take some actions. And I think there's a section about that, and that I can talk about later. And maybe like the last thing that I wanted to share, triangulation is key. I think we all agree with that. But in reality, it's very hard. It's very hard to do, not only because the tools for social media monitoring, community feedback are not necessarily compatible, not only because of the speed, because those who are collecting community feedback, they need time. It's very time and resource intensive, so you won't have insights on a daily basis. Whereas social media monitoring, you have to follow things on a daily basis. So here the tools are a little bit different. And we did try, actually, in one of our pilot country to collect the data and centralize everything in one rumor log, but it didn't work that well in that context. So what we did instead is that we agreed basically that, okay, you will do your thing, we will do our thing, and then we'll convene and meet together, and then triangulate during a meeting, and then discuss what we should do. So putting also a little bit more context into the data that people collected from their side. So I think this is what I can share about data collection and analysis. Over to you.
Thanks, Elodie. That was very, very complete, very rich, and certainly like touching upon a lot of the different barriers that we've discussed. I wanted just to ask to our audience whether there's some questions that you would like to ask. Otherwise, I have one little question before we jump into the second set of findings. But just wanted to give the opportunity to anyone. No questions? Okay, then I will. I just have one last one for.
I'm sorry. I think there are a couple of hands up.
Ah, are there? Okay, sorry. I didn't see them. So sorry. Okay. Who is where can I see the hands up?
If you click on the participant.
Yeah. Okay. So okay. Jeffra? Yeah. Jeffra, over to you. Jeffra? Okay, maybe it was
I think they need to be unmuted, no?
Yeah. Jeffra, could you share your question in the chat? I think that would be easier. If you can all share your questions in the chat, that will be easier for us to then channel them to the okay, you don't have the mic with you, to the different speakers. Okay, just maybe while we get their questions in the chat, just one quick one for Elodie on the data, like identifying identifying data. Triangulating data. And my question was like, what can we do when we also have like, we don't have data from specific groups, specific vulnerable groups, because they're just not in public spaces, they're not, or they retrieve to more private spaces, both online and offline. Is this something that you've encountered, and how did you address that? Over to you, Elodie.
Thank you, Lucio. I think here I will again share what we've learned, because this is a very, very challenging thing that you're bringing. From our side, what we did to listen to some conversations on private social media platforms such as WhatsApp. And actually WhatsApp is very interesting because you don't need a very strong internet connection, and you have a lot of people in kind of remote communities who have access to WhatsApp. So information circulates quite fast on WhatsApp, and it's also a little bit more trusted by some people because you usually receive something from someone you know. So you tend to trust that a bit more. And also this is a kind of favorite platform for disinformation also. So what we are trying to do here is basically to have tip lines. So as I said, IRA is really based on a network of different actors. And we are working a lot with journalists in the country, at the country level, and also fact checkers wherever we can. So they are in many WhatsApp groups, and they receive also tips about a disinformation piece or something that has been shared a lot of times. So then they share it back to us, and then we try to investigate a little bit and also triangulate the information, and then we decide if we want to put it in our report or not. One example was there was a video about allegedly a Pfizer executive acknowledging that basically the research is to produce more mutations of the COVID-19 virus. And that has been very, very, people have shared it widely on WhatsApp and Telegram and Signal. So these kind of things, this information was actually raised to us through our tip lines. So this is kind of the way we try to go around it. This is not perfect, of course, but this is where also it's very, very important that we are transparent about the limitations of our methodology, and also when we share our report, we are very honest also about that. So it just provides a snapshot, and it just helps us identify things that we don't see through the social media monitoring softwares. Over.
Thanks, Elodie. Thanks so much. We now have a lot of questions. However, we're running a bit late for the second set of findings. So maybe we can go ahead with it and then respond in the chat. And then again, we encourage you to make the questions on the specific set of findings in the chat, and we will try then to have it in the next round. But we will try to address these ones in the chat directly. Over to you, Alejandro.
Thank you, Rocio. So now we're going to go into the next set of barriers and recommendations. This time is the ones that are related to presenting and sharing social listening findings and how that ends up affecting our ability to act upon the data. Here, we also realize that there's variations in the types of products and the frequency in which they're shared. However, there was a common focus on the importance of regular, timely, and contextualized dissemination. Most projects agreed that a wider dissemination of findings across sectors and beyond just the RCCE spaces and stages of the response would be ideal. However, as the barriers will show, this is not always the case. So to start with the first barrier, this is about data sensitivity. What we found is that data sharing between organizations has its limitations, as it can expose communities to additional risk if an unauthorized person gets access to the data. you can put those individuals or groups at risk of verbal and physical harassment, something that is exacerbated with vulnerable population in humanitarian sectors. You can also risk by exposing those users behind the data, a potential migration of that conversation into private spaces. And as a result, some organizations choose to be selective and vague in what they share. However, there's a downside to this, as the data shared does not always have all the important details for a targeted response, which limits its usability and our ability to engage in dialogue with the users behind that data. The second barrier here has to do with how we process negative feedback. What we saw is that the data collected, social listening data, in many instances, can actually be critical of governments, institutions, and humanitarian organizations. This actually affects wide-scale dissemination because there's a sector-wide stigma over negative feedback, which means that organizations might actually decide to address this feedback internally as opposed to sharing it with others. Similarly, some might decide to omit critical content of other actors to avoid fracturing relationship. All of this reduces our capacity as a sector to act upon both positive and negative perceptions that might exist in the communities. The third barrier in this regard has to do with coordinating dissemination. Again, all of the speakers here agreed that, that disseminating and sharing findings together would actually be ideal between organizations. But issues such as bureaucracy and conflict over ownership of content actually can slow down the collaboration. We heard some examples during the interviews of decisions on where logos go or what information goes where. And this actually affected the timeliness and the relevance of the response. As Elodie was mentioning, the timeliness is very, very important component of how we communicate social listening findings. There's also a common phenomenon of sharing data in the same echo chambers, which ends up affecting the impact of the data on a wider response. Products tend to be mainly disseminated amongst RCCE and communication staff. This actually limits the possibility of reaching senior management and other areas of response beyond the traditional RCCE pillar. Additionally, we heard that people analyzing the data and writing the reports and drafting the recommendations are actually tend to be technical experts within RCCE. This limits the analytical lens that is applied and the potential to use this data for broader health approaches. So those were some of the barriers that we identified. I'm now going to go into some of the recommendations that we brainstormed to mitigate those barriers. So first, for decision makers and for project managers, the first point is to make sure that you're assessing who are you talking with and what do you want from them? Who are you talking with in terms of sharing the findings, not who you're listening to. It's not the same discussing with RCCE groups than it is with health cluster leads, project managers, or risk experts. As such, it is essential to have a broad outreach strategy going beyond, sorry, I think someone has their mic unmuted. It is essential to have a broad outreach strategy going beyond RCCE and to be clear on what you want to obtain from these different audiences. A key strategy that worked for many of the people of the organizations we interviewed is to actually hold bilateral meetings with these organizations to help them define that the data, to help them define the value that the data can provide for them. Ancelot, you have yours microphone unmuted. Thank you. If you can mute. The second recommendation is to make sure that you understand your audience's needs and their interests to package your result in the best way. What's important here is to consider your audience's scope, their size, and the type of work that they're doing to understand how the data can actually be used to them. According to our findings, grassroots organizations and local NGOs tend to show the most interest in the actual data and the recommendations in order to support their engagement with communities. while larger organizations are more interested in the methodology and how to incorporate that methodology into their structures. Third recommendation here is to acknowledge your limitations and to be transparent about who is included in your data. Transparency is actually a driver of trust and of structural decision-making. It is very important to also train your partners on the value of social listening data before you actually share the data with them. There's many organizations that receive social listening reports, but they won't be clear how to make a use of it. So it's very important to introduce them to the possibilities and the opportunities that social listening can provide. And it is an important first step to engage actors who might be skeptical about this data. Finally, here, it's important to be open about negative feedback that suggests gaps in your programming, even to outsiders. This will actually help us identify broader gaps in the response, identify possible areas for collaboration, and ultimately, it will enhance accountability. Now, three sets of recommendations for data collector and analysts. The first one is to consider having both a private and a public data product that you can share with partners. This responds to that data sensitivity barrier that we presented. This can actually help breaching that data sensitivity, and it allows partners to access information that can actually guide their work. The second one is to make sure that you're involving different actors and expertise during the write-up of the recommendations. This includes experts from different sectors. And the idea is that the recommendations can expand beyond RCCE. This ensures that the data can be granular and specific enough so that it can drive adaptations and programming in other sectors. Finally, it's always important to involve community members, discuss with relevant members of the community. They can be very useful at suggesting appropriate and relevant recommendations applicable to their context. And now we are going to hear again from some of the panelists. Over to Rocio.
Thanks so much, Ale. Yeah, thanks again for sharing this set of findings and on barriers and recommendations on the specific data presentation and data dissemination. I would like now to pass it over to Mateus, as we would like to discuss a bit this issue on the resistance from certain organizations and certain actors to share either their own feedback, their own social listening data, or work and respond to the collective data more due out of reputation issues, or because they're more afraid of responding to other actors on the gaps in their own programming, etc., etc. So now over to Mateus on this issue.
Hi, thanks so much, Rosie, and hi, colleagues. Good afternoon to everyone. I will apologize because I'm struggling a bit with my connectivity. If I have any delay in my video or so on, I'll try to put my video off so I can enhance the communication, but I hope you can hear me well. So I think there are some specific topics that we need to consider when trying to deal with the overall coordination, specifically with different numbers of partners and stakeholders that are trying to coordinate into a same goal. So as mentioned by my colleagues from Ground Truth Solution and as well IDA, I think we need to first of all understand that each organization has different methodologies, different patterns for collecting and responding to feedback. So for example, from the IFRC, from the Red Cross and Red Crescent national societies, our powerhouse is basically together with our network of volunteers going for a majority of offline community feedbacks that are being collected, analyzed, and responded. So as mentioned by Elodie, the time that you have to collect a face-to-face or a hotline methodology is completely different from the speedy time, for example, for an online way of collecting that particular feedback. So how we can put them together and how to make sense of these different methodologies, it's a bit of the main challenge that we encountered. I think in practical terms, we need to also understand that the balance between the flexibility of having these different methodologies and how to make sense of these methodologies so they can make sense in a coherent way collectively, so we can present and make sense of the data. I think oftentimes we are too focused on collecting as much as data as possible, but not necessarily going through the same time of how can we make sense of them and make them being actionable. And I think that's the key challenge that we try to tackle, for example, during the interagency community feedback and social science sub-working group that we have together with UNICEF colleagues, WHO, and the different sub-working groups for feedback. So specifically when presenting, as Alejandro mentioned, some sensitive feedback or something that is perceived as a negative feedback involved either organizations or as well governments specifically. And I think COVID really showed us how the government role was vital for improving and presenting these findings. We had, depending on the countries, a bit more of openness to deal in an honest and straightforward, perhaps, way of dealing with feedbacks that are not necessarily praising our work or the government work either. So how can we ensure that different partners such as governments and other organizations can understand the value to deal with all these different types of feedbacks in a constructive way? So I think one of the key recommendations that we had, and specifically putting again the collective service and the sub-working group for Eastern and Southern Africa example, I think it's a quite practical one when we can have partners together and have this peer-to-peer learning and peer-to-peer opportunity to discuss and have this share of responsibility for the different types of community feedbacks, rather being sensitive or rather being positive, or depending on the perceptions that we have. We know that in theory, we should all have this joint spirit to go into the same goal, but in practice, we may find some of these barriers. And from our perspective and from our main lessons learned from this joint effort, I think the constant communication, having the proper space where different partners coming from regional level, cluster levels, or community actors and local organizations. Sorry, colleagues, I think there is someone with the mic open. But I think from the main lesson learned that we had is trying to find the balance between the different methodologies from different organizations, having a common language or a common understanding in an open and regular space where we could openly debate, and then taking the share responsibility for the different types of feedbacks and really working together at the different levels, either with the governments or other organizations, to ensure that the full understanding of how to have them in a constructive manner, having the criticism in a constructive manner, it's at the end what is our role, our mandate as different humanitarian organizations and partners in stake. So I think that would be my main overview and ideas for that particular challenge. I know that in practical terms, we have to find some specific channels where coordination is and the regular information will go for it. But I think we can have these at least for the first overview for some of the presentations challenge. Rocio, back to you.
Thanks, Mateus. Just very quickly, because we're a bit, just a couple of minutes late, but I also wanted to hear your thoughts, Mateus, on how you've been dealing also with trying to be relevant, right? Like understanding that the specific epidemic or health emergency is continuously evolving and fast evolving. How have you been dealing with the barriers of remaining relevant and timely with social listening data and when sharing it with other partners and trying to drive action on that? Just very quickly, if you have just some thoughts on that, and we can jump to Elodie after.
Yeah, sure. I think, as colleagues mentioned, the COVID-19 pandemic, it really showed us how rapid informations were changing. So how we had to constantly be updating and changing and adapting ourselves to still ensure that we will be relevant for the operations. So I think having the set of these opening mechanisms coming from different sources, so trying to make sure that we can triangulate and have a set of different community feedback channels that would be working from different organizations. So having the Red Cross, Red Crescent on the ground with volunteers, making sure that we could still have some overview and leverage with hard to reach areas, for example, and trying to compile them with the social listening that the ARA members were doing, and trying to triangulate these informations and really ensuring that, yes, COVID, it is an issue, but perhaps it's not necessarily the priority, or it's not perceived as a priority for that particular community for X or different reasons. So ensuring that we can triangulate different methodologies and preferred channels of community feedbacks, I think this was something that we were fairly able to achieve, collectively speaking, and as well making sure that these recommendations, as Alejandro mentioned, they can go perhaps beyond only the RCCE or the community engagement accountability scope, right? So if you are dealing with communities saying that the hunger crisis is the priority, how can we link them to the existing other agencies or spaces or different forums where we can at least refer to different sectors or different partners so they can be aware. So taking from COVID, but then linking up with the existing structures from different partners, I think this would be one of the main ones.
Great, thanks, Mateus. That was super useful. Now I would like to discuss with Elodie a bit more on how to make this data, the social listening data that we're collecting and sharing with others, how can we make it as accessible as possible for all those partners, and what strategies IDA follow to try to ensure that the data reaches as much people as possible and it's actually useful for their response. Over to you.
Thank you, Lucio. I think we are all struggling to make sure that our data and the reports are actually reaching those who need it the most. So I think we need to be realistic also here about who we're targeting and who we're talking to when sharing our information or sharing our reports. So I'm sitting at a regional level. So it is very challenging, of course, for us to make sure that a certain country or a certain district receives that information. So what I can say based on what we experienced is when we spot something a little bit concerning, because our line of work is really infodemic. So when we spot something a little bit concerning, we reach out to people on the ground and we share what we saw, which is not very detailed, not necessarily. And so then we try to discuss with them if we can find more information and also what actions can be taken. And I think that here also, I heard Alejandro speaking about echo chambers. And this is something that we need to be very aware of, because in many social media monitoring and also community feedback, we focus a lot on people's voices, of course, but for the COVID-19 pandemic and also other outbreaks that we're experiencing, it's important to put that into perspective when it comes to the health system and the whole response. I have in mind one example is one country in Africa. The demand was actually very high for the vaccine, but the main barriers basically were logistic. You know, how people would access the actual vaccine, and so what can we do as IRA to discuss that point? Because basically messaging is probably not the answer here. Fortunately, we had someone in that country who liaised with the Ministry of Health, and then basically just to re-emphasize and share this information with the relevant actors in the country. It works when you put a lot of efforts. Of course, it requires a lot of advocacy here because everybody is so busy and competing priorities, of course. But this is what we managed to do in some countries. In other countries, it's a little bit more difficult depending on the structure and how the different departments are working. You know, so it really depends. But what we found successful is really sharing the information with the people on the ground. And also what we did actually is I mentioned earlier that we had 5 pilot countries and we hired someone full-time to manage infodemics in the country. And the fact that we had someone there was very useful to build a capacity at the local level from capacity of journalists, not only public health experts, but also journalists, for example, fact checkers or community workers. And we train them on how to use and triangulate some of the information. So then they will be able to monitor at their level and also in different languages. So then the information will be more relevant for the users, you know, for the audience of the report. So this is kind of some of the approaches that we took that seem to be successful so far. Yes, this is basically our lessons learned on that point.
Thanks, Elodie. Yeah, indeed, all those strategies are very useful. Also, like trying to think of different actors, different stakeholders, and certainly like adapting and packaging a bit like the data to what is relevant for them, right? Because it's not always going to be the same for RCCE responders than also other decision makers within the health response. And we had actually a question from Jeff around this. I think you responded to the question, and we will also go over some additional recommendations in the third section. But certainly, like I feel like having this more open like outreach strategy, let's say, when we share this data, it's an important one. Just trying to think of which other like decision makers are out there, and which other like also community level structures can be of support for the response. And when you mentioned like journalists, you mentioned local media, etc. These are certainly CSOs, are certainly also like very important actors that we should be like considering. I don't know how we're doing with time. I think we have like time for some questions. I don't see any questions for this specific set of findings, so I will just go to the previous one. We have one from Megan Liebensberger that says, for those of you who are like supporting global work in countries where you do not reside, what tools do you find most effective to support offline social listening? So I guess maybe for Mateus this would be like a good question on like face-to-face social listening methods. And then after to Alejandro or I can also support a bit the response. Over to you, Mateus.
Hi, thanks so much for the question. So in our case, for example, from the regional perspective, let's say that I think we work at least trying to identify who would be the most relevant or the most best positioned partners, if possible, to cooperate within specific country. So there are a number of different training packages, for example, that can be rapid training packages, either at a volunteer level or depending on the branch level of organization. In the case of the national societies of the Red Cross, Red Crescent, branch levels and HQs. But I would strongly encourage, for example, the rapid trainings for different levels and try to identify, if possible, I know not necessarily easy to identify depending on the existing network in the specific country, but trying to identify who would be the best position to develop or trying to conduct some of these standardized training packages, so we can also build the capacity. We can strengthen the capacity for local organizations or local partners, local actors on that, or already relying on their knowledge and their experience in country within these particular methodologies. So within the training packages, there are a number of different tools that can enable, for example, the data collection. So they are a bit more practical tools. So they can have a number of different sets, either like a COBOL form or like a standardized coding framework to support making sense of the data. But they are normally all incorporate already in these training packages. And I think we'll be very happy to circulate, perhaps Rocio, after the call, a list of useful materials or resources that partners can be aware and see how to best fit into their specific purpose. Back to you.
Sure, I think that would be very relevant. We can send around the slides and also like a couple of links with different resources. I would also like to pass it over to Alejandro also on this question, because I think it's very important that we also consider, as Mateo was mentioning, like what is out there, what is in the community, and which actors we can engage with, and this also talks about trust and talks about who is already part of the community. So just very briefly, 2 minutes to Alejandro on this, and then we jump into the third final section of findings.
Great, thanks, Rocio. Yeah, I think the question at its core is asking about how can you actually do social listening when you're not in that country, when you're doing it from abroad. And I think we've had that experience during Rooted in Trust, and it's a struggle because we do identify the importance and the value of working with local organizations and hopefully the community carrying out the data collection and the analysis, as we mentioned in the call. So of course, there's a variety of software that you can use to capture social listening data in other countries, but it has a lot of limitations. Something that a quick practice that came to mind that in Rooted in Trust we found quite useful is that even if you're not able to be in that country, you might be able to partner or work with people that are from that context, but might be like part of the diaspora. And we found that working with the diaspora and involving them in data collection and social listening for contexts in which we're not able to do that in country has been tremendously useful, as they do have those sort of that contextual and local understanding and have probably worked in the community and understand sort of that, which really comes, you can see it when the analysis comes into place. That qualitative component and that understanding is super valuable. So that's a practice that we've used and it's been really useful for us.
Thanks, Ale. Thanks so much. Yeah, just adding up on that, it's very important to consider these community level organizations and these community actors, as they're certainly, as Alejandro was mentioning, like they're part of the community in the diaspora. They may be away, but they certainly understand what are the priorities, what may also be the risks that the specific group or the specific community is facing, and they also know the spaces. They also know where the conversations are taking place, and something that is very important. They're like holders of the community trust, so they can help in identifying what are the needs, and then also helping us in analyzing and translating or helping, like informing, let's say, the health response and the technical expertise into how to shape the response. Now I will shut up and I will pass it over again to Alejandro for the third set of findings, which talk about like actioning the data. Over to you.
Thank you, Rocio. So we're going to get into this final set of barriers and recommendations. Before I do encourage you to read the report and look at the report. My colleagues can share the link in the chat, but it's also on our website. And if you do have questions, try to ask them through the Q&A part, as the various speakers are actively responding to all of them on that Q&A section. It's easier to respond to them there than in the chat. So now we're going to talk about this final point where we're actually turning the data into action. And you'll notice that here we differentiate a lot between actions that are taken internally by the organization that's collecting the data, and externally, meaning by other organizations that are exposed to the findings. Unfortunately, as you see, the latter one is actually quite complicated to achieve sometimes. We're going to talk about some of those limitations. So the first limitation has to do with limited monitoring and evaluation. What we saw through the interviews is that traditional monitoring and evaluation frameworks fall short of capturing some of the more abstract and structural impacts of social listening findings. So to give you an example, we can count the number of citations or the number of times that a social listening report has been downloaded, and this can give us a general idea of the reach. But it is not telling us much about how the findings led to more responsive programming, how they made it into policy design, etc. So this limited evidence is created, and therefore the ability to convince others in the response, like senior management and donors, of the needs to pay more attention to this type of data is limited. So it's kind of like a vicious cycle. Second barrier that we found has to do with programming, and this is very dependent on the donor. But sometimes the structure and the workflow of humanitarian programs and the design complicates the ability to routinely act on the conclusions or recommendations of social listening data. This is because many projects have pre-approved plans. So you see that recommendations that are more communication-based are easier to integrate into existing programming. But when we're talking about more difficult to adapt and more structural recommendations that require significant changes, it becomes much harder to adapt and change one's programming. A third barrier, which relates a little bit to that echo chamber that Elodie was also mentioning, is sometimes this silo organizational culture. Basically, conversations about actions that can be taken on social listening are often motivated by each organization's or each institution's mandate, their existing programming and internal policies. So there's a significant barrier to responding in a timely and flexible way to meet the needs of communities as a coordinated response. Moreover, it becomes difficult for externals, so external organizations, to take ownership of the conclusions and actions of the data that they did not actually collect themselves, especially when those conclusions are suggesting that there's needs for changes in their programming. This is something that was also discussed by Reiki during her intervention, and it's a particular barrier that we found for projects that focus on one topic, let's say COVID-19, listening to COVID-19. With time, there are actually changes in attention and priorities, which actually limit the reach and action. This is exacerbated in humanitarian context, where there's a higher likelihood of multiple and simultaneous crises, which make it harder to keep the attention of decision makers and encourage them to continually adapt to programming based on social listening data. And the final barrier that we found that is related to what Mateus was mentioning has to do with the political context behind the recommendations. And so what we saw and we've seen through our projects is that the recommendations that can be provided can actually be limited by existing legislation and mandates of the MOH or other health institutions in some countries. This is mostly relevant in terms of providing public health guidance, but it limits how partners can respond or inform about certain things beyond key messages of specific health agencies or the MOH. So in some contexts, there's like strong editorial control, while in others, the relationship with agencies is key and there's a concern of overstepping. So in summary, basically in some contexts, what can be recommended and the ability to follow recommendation based on social listening data can be greatly influenced by political contexts. So similar to the other sections, we're going to go into some of the recommendations. All of this has much more details and examples in the report. So I do encourage you to check that out. But for donors, we have a recommendation about ensuring that you are ensuring flexibility and allowing space for unforeseen adaptations, even if they seem large, especially when they're guided by the data that we're finding. And another one is the importance of supporting the institutionalization or the mainstreaming of social listening across sectors and programs. Like the COVID-19 crisis has demonstrated the importance and the usefulness of social listening in health emergencies. But this can also support many other non-health components of the emergency response. So it's important to think about that. A set of recommendations for cluster leads, for steering collectives and coordinated response. We have 3 recommendations here. The first one is to develop a collective action tracker shared among members of the coordination group. This can actually drive collective ownership, utilization by different organizations, and increases capacity to monitor impacts. I think this responds to one of the questions that I saw on the chat of how you get others to act on the data. The second recommendation is to develop supportive collaborative recommendations. What this means is that cluster leads have a unique position to foster conversation from partners on what could be done after the data is shared. We know, and we've talked about this, it might be challenging to convince external actors of turning social listening findings into action when they did not collect that data, when that data does not belong to them. However, if you involve them in collaborative approaches to data gathering, to data analysis, or to the recommendations, and you draft those with a diversity of actors, this can actually strengthen the ownership and commitment across partners and sectors. So it's a recommendation to respond to that. Only in some contexts, we found that it might actually make sense to centralize resources such as tools, data, and expertise for infodemic management. An advisory, some mentioned that it could be useful to have an advisory board that represents the interest of each member organization. And in other contexts, you could consider where there's only local capacity for data collection, you could actually centralize data analysis and M&E efforts. A final set of recommendations for decision makers. We have 3 here. So the first one is to make sure that you're dedicating resources to tracking outcomes and impacts. We want to understand who is using your data and development indicators that can monitor the impact of social listening, internal and external, and hopefully beyond RCCE. This is gonna get the ball rolling, and it's gonna break that vicious cycle. For example, things such as tracking direct actions, tracking decision-making and adaptations. The second one is to listen to the secondary impacts of humanitarian crisis and adapt as relevant to remain useful, to remain useful. So this relates to what Reiki was mentioning at the beginning, but basically, while it's okay to have sort of like, let's say a single topic that you listen to, it's important to look at the secondary impacts of that topic. So something like focusing on COVID-19 rumors might actually end up meaning that you collect data on how COVID-19 pandemic affected food security, or how it affected shelter, or other components. Finally, and this final recommendation, again, related to the action tracker, is consider designing and continuously feeding an internal action tracker. This is something that some organizations found really useful. sharing responsibilities across different expertise with clear roles and responsibility to act upon the recommendation. So who is going to do what based on the finding and the recommendation that is provided. These should be done collectively by different expertise level within the organization, as social listening data can provide timely and relevant information on needed adaptations beyond just RCCE plans. So that's the last set of recommendations. They all have examples on the text, but now we're going to start the last session of discussion by speakers.
Thanks, Ale. So thanks so much for introducing us to all these barriers and recommendations on how to better take action on the data. And while we were discussing obviously like different levels of relevance to the action that can be taken, I wanted to take the opportunity to discuss with Rike and trying to understand what barriers have they faced when trying to drive actors to respond to the specific findings that they were getting from their social listening or community feedback exercises, and what were also the recommendations that they have to ensure that these actors actually take action and relevant action on that data, and adapt their programming accordingly.
Thank you, Rocio. I think I will repeat a couple of things that Alejandro has been saying, but give some practical examples from our work. So I think a key point is, the interaction with data. So what we saw is when we were collecting the data and we hadn't involved many people in the design phase as much, that people were very keen to get as much data as possible with monthly bulletins or dashboards, but then it turned out that a lot of people struggled with understanding the data, and we had kind of overestimated the data literacy of our key audience. And I think that kind of shows that the whole process is not linear, that it's important to, in the inception phase, in the design phase of your project, that you include the stakeholders, the key audience you want to listen to your data, that you involve them in the earlier stages as well, so they have an influence on what kind of data and how you're going to collect the data. So they have kind of an ownership on the data collection and will be more likely to act upon the findings because they have been involved in the whole process. And one point that was made about the flexibility and donors and the kind of strict programming that people have to adhere to. This is a main barrier that we hear all the time when we present our findings, is that it's great to have this information, it's great to have these findings. We have this plan that was made months ago or a year ago and we cannot change it. And I think this donor flexibility is incredibly important to make sure that people have the flexibility, that organizations have the flexibility to change their programming according to what is happening on the ground. And I think the recommendation that Alejandro presented there, that the funding for projects should be more flexible, is an incredibly important one, but also that it should be incentivized, it should be more attractive for organizations to change their program based on new information that arises, which is currently, I think, not the case. A lot of times people say, okay, this is great, but it will be very difficult to change your programming. But people need to see that it will actually increase their effectivity of their programs and improve their outcomes if they use these types of data to inform their programming. And I think, a last point that I want to make is kind of, being more intentional about what you want to do with the data. So some practical recommendations from what we do at Ground Truth Solutions is to organize workshops with key stakeholders in country, and this can be on a regional level, this can be on a national level, this can be on a global level, to develop key messages and recommendations with the key audience, to make sure that the data is used in a way you intended to be used, but also to make sure that the information and the key messages we develop are tailored and relevant to our key audiences. So I think that is a process that you have to be very involved in as the data collection partner, yourself, or as the organization who's behind the data collection. But then again, it makes your research much more relevant and makes the take-up of your findings much more likely. Back to you, Rocio.
Thanks, Rike. Thanks so much for this. Now we have just 7 more minutes, so I will quickly pass it over to Mateus. I think he can share with us like a very successful model on trying to drive also like collective responsibility and action on data. This is a part of the ISAR feedback sub-working group that takes place in Eastern and Southern African region. And I think this can be also very helpful for our audience. So over to you, Mateus, to share the recommendations there.
Hi, thanks so much. So yeah, I mean, just echoing a bit of Rika just mentioned, and I think we need to be as honest as possible here and trying to be very practical and straightforward. When it comes to act on feedback, this is the key thing that we are overall failing or not. We can do better as overall partners and organizations on the critical acting part. And I think we've been seeing that over and over from different epidemics and different responses. It is basically really coming back to walk the talk. So really making sure that all the different analysis, the dashboards that we are producing, the data that we are collecting, the reports that we are collecting, they need to be concretely translated into practical actions, into actions for communities that we are serving. And the reason why I'm stressing this is because for the nature of the Red Cross and Red Crescent National Society's work, we are not on an online conversation. I think this was the Rick first point. Our volunteers are on a daily basis interacting with communities because they are community members on themselves. So it's basically really important to make sure that also in a way of protecting the frontline workers, whether Red Cross volunteers or health workers or different types of frontline workers, we're ensuring to really act on that feedback, even though if this means being on a regular basis, communicating openly and honestly that we are unable to go beyond a certain aspect or for different reasons, for donor restrictions or different operational constraints and so on. But keeping up the relation, the trust relation with communities on the actions, it's fundamental. And we know and been seeing that over and over. So I think I just wanted to be as straightforward as possible into that particular point. And then going back for the collective service and the community feedback sub-working group together with UNICEF, WHO, and IFRC, what we really learn together collectively is that in this interagency cooperation, where we are aiming to have one voice as partners, it is also in practical terms, how can we distinguish, recognize, and follow up on the action points needed by each individual organization, despite the overall collective effort, right? So I think, as I mentioned before, having the regular space where we can debate and have very practical and simple tools, such as a spreadsheet with the action, the feedback collected, the action that needs to be taken, the timeline for that, and who will be following up on that, and try to keep these on a regular basis. Of course, sometimes facing challenges, practical challenges to implement, but again, trying to cooperate and make sure whoever is best placed at that moment or in that particular area should take this action forward. So I will again stress some of the practicalities of these cooperations and how these work on a day-to-day basis, that although might sound simple, they can be quite effective as it is in the case of the SR sub-working group, for example. So yeah, I think that's it from the main experience that we have so far. And back to you, Rocio, just aware of time as well.
Thanks, Mateus. We have 2 minutes, but I would like to actually just drop the question to any of you who wants to respond, because I think that it's an important one. There's a question from anonymous participant on how we can mainstream social listening into, I understand it's into other kind of projects, right? We've been discussing here health emergency, public health interventions, and Alejandro mentioned before, like there is certainly like the opportunity for social listening to inform all kind of projects. So I just wanted to share it out there and see whether you, Mateus, or Alejandro, Elodie, Rique, anyone wants to respond and also bring some practical examples maybe from other kind of non-health response where social listening has been used. Just very quickly, 2 minutes, 1 or 2 minutes.
Very quickly, just at least from my end, understanding, at least from the Red Cross and Red Crescent perspective, when we talk about social listening, is basically our core community feedback work, right? And this is not limited to the health emergencies. I know that we've been for COVID under the RCCE pillar, which is a pillar under a health response, but for different types of responses, cash responses, or different sectorial themes areas. You also have the core community feedback / the social listening being a core part of these programmatic different areas. And we also have, for example, from our end, we produce like the feedback toolkit that is also a useful tool to go for specific areas such as cash or such as shelter or in different WASH sectors, how we can integrate the social listening community feedback piece of work in these different responses. So yeah, I think that's a very practical one and useful tool as well, and happy to share that after. Back to you.
Thanks, Mateus. Yeah, I think that's a very good response, and we would also be very happy to share more of our methodologies, as also in Internews we've been using social listening and rumor tracking throughout different projects, not only the Rooted in Trust project, but actually also in different regions and in conflict settings, or also in migration, complex migration, also crisis. So it would be great to try to brainstorm and discuss with any of you who's interested to see how this approach can be certainly adapted to responses beyond health. So I think that's it for now, unless anyone else has anything else to add. We're exactly on point in time. And yeah, as mentioned, we will share with you, we have all your emails, so we will share with you the slides, the report link again, and also we will gather some resources from all the speakers and send them to you. Just reach out if you have anything. We will drop our emails in the chat box and reach out if you have anything else to ask, to comment, or just to give us some feedback on the event. Now, yeah, over to you, Ale.
Oh, just to jump in super quickly, thank you very much, everyone. It was super exciting conversation with lots of great questions and insights that get us thinking a lot. If you enjoyed it, yeah, please keep an eye out for our future research. We're involved on different research projects at Rooted in Trust, and they're constantly coming out and being informed by all of the actions and practices that we're carrying out through our project in the 13 countries where we operate. So yeah, just a reminder to keep your eye out for new research outcomes that might be coming out of Rooted in Trust. Thank you.
Thanks, everyone. Bye-bye.
Thanks, colleagues. Take care. Bye-bye.
Bye.
Thank you. Bye. Thank you for moderating.
It was great.